Okay, can you guys hear me now?
Yes.
Hello? Okay. Some issues this morning for some reason, but good morning, everybody. I know it's kind of late. 4 minutes after. Today's February 23rd, 2021. Let's say Tuesday. It's been you guys are biology 1160 section 2, and I think the last time I saw you guys, you were taking your first exam, I think, which was Thursday of last week. Is that right? And then the Thursday before that was last time we were talking about the skeleton. And so that's where we're going to pick up. And from what I can recall, we're going through the skull. I think we finished the skull, didn't we? Yeah. And we're almost finished the skull. We finished the facial bones, and there was the cranial bones, and then C, I have the hyoid. These are like other bones associated with the skull. And so this is, I think, where I'm picking up. Does that sound right? Does this sound like, okay, everybody's nodding their head, so I guess that's right. So let me pick up here, get this going. And that looks okay. Let me fix this for everybody in here. Hey, there we go. The hyoid bone. I don't know if you remember last time we were talking about facial bones, and we included actually the first one I mentioned was the dentary bone or the mandible. And I was struggling with, including that as a facial bone as the author of your book does. And that's okay, because, think your jaw, your mouth, and it's part of your face. But in most other vertebrate anatomy courses, the dentary bone and the hyoid bone are kind of ranked together as separate entities associated with the skull. And if you look at them, they look very similar, both kind of horseshoe shaped, and, kind of in the throat and that sort of thing. And that they have an interesting evolutionary history. But anyway, I don't really talk about that in this class. I just kind of mentioned the hyoid bone is like another bone kind of associated with the skull. A lot of people just kind of forget about it because you don't really see it that much. It's just kind of suspended in your throat, and that's about it. A lot of times you don't even know it's there. Like if you do hear about it, it's probably like in one of those CSI shows when they're doing like murder investigations, and if a victim of some crime has a fractured hyoid, they always suspect strangulation, because there's no other way you can break your hyoid bone. You can see on this subject right here where it's located. It's right there in the throat, right above the voice box. And it's kind of horseshoe shaped, kind of mimics the opening of the larynx as well. But it's not your Adam's apple. A lot of times people assume that's your Adam's apple. It's not. This is at the base of your tongue. You really can't feel it. Like I said, to break it, I mean, you'd really have to grab somebody's throat and squeeze hard. But anyway, I didn't want to leave it out. So here's the hyoid bone. It's not, I'm trying to think. I have skull, 22 bones. I don't think this is included with those 22 bones. I'd have to recount, I guess. I don't know. That's not that important. But anyway, it's associated with the bone. Here, I tell you, it's not actually a component of the skull, as you can see. Doesn't articulate with the skull. As a matter of fact, it doesn't articulate with any bone of the body. If you think about the skeleton as a whole and dismiss all those other weird bones like sesamoid bones and wormian bones, those kind of things, this is the only bone of the body that doesn't form an articulation with another bone. And actually, that was a question on Who Wants to Be a Millionaire? Remember that show? Who Wants to Be a Millionaire? You're on stage and they ask you these questions, and it's usually like a multiple choice type question, I think, and you have lifelines you can call and get for help. Does that sound right? Isn't that how that would go? Is that show, is it still on, or it came back? Or I'm thinking of the Weakest Link. That show came back. It came on about the same time and then it went off the air. But anyway. But that was a question on that show, I remember. It said the hyoid bone is the only bone in the body that, question mark, you know, you had to fill in the blank, multiple choice. And I remember I was in my living room watching that, and I was jumping up and down. I said, oh, my students know this answer. They know what this is. But the individual burned up a couple of lifelines trying to figure out what it was. But what it is that it doesn't form a joint. But that's really not true if you think about it, because none of your sesamoid bones form joints, right? And if you look at this one, it's almost like a sesamoid bone, but it's really not. It is suspended in tissue in your throat. But if you follow the developmental history and the evolutionary history of this bone, you can see it has the same kind of background as the jaw, and it's related to the temporal bone and so on and so forth. I think I say something like that. It's classified as a cranial element because developmentally it's related to the temporal bone. And if you look real closely, let me get my laser here, right here. You can see, I got stuff popping up on my screen. See that? When I do that, I can't see anything. The people in the auditorium can know what I'm talking about. You guys at home just think I'm crazy. I don't see nothing. But that's, anyway, I can't point to stuff. See my pointer, as soon as I get too close to something, there I can do it. If I go like this, it pops up. I quit screwing with it. Right there. And then, they show you this one muscle. There's other muscles too. This muscle is called the stylohyoid muscle that articulates between the styloid process and the lesser horn of the hyoid. These are things that you'll learn in lab. Don't worry about that for lecture. But anyway, if you look real carefully, this little process that sticks up here, and then there's a process that hangs down right here. They are fused, like in the early skull. So you can see that there's some relationship there. And I think I remember telling you guys when we were talking about remember the temporal bone? I said it was a composite bone. It's composed of like different ossification centers that kind of come together to form one big bone. And in lab, we'll talk about the different regions of the temporal bone. Remember the squamous portion? That's the portion that forms the squamous suture, where it articulates with the parietal bone. And then there's a mastoid portion. That's what you see here. That's underneath, and a lot of that mastoid portion is associated with the hyoid bone, as well as the mandible too. And plus, if you look at this, it kind of looks like a little. It kind of looks like a little horseshoe, and then if you put little teeth on it, it looks like a little jawbone. So anyway, there's your hyoid bone, but it's not really that, I guess, profound or exciting in the human body. It's just kind of there. Serves as attachment sites for throat muscles. I guess you can say aids in helping you swallow, that sort of thing. But it's just kind of a bony remnant in your voice box. So there's that. So remember what we're doing. We're going through the axial skeleton. We started with the skull, and we're kind of working our way down into the throat. Now beyond the skull, next you'd have all the vertebrae. So Roman numeral 2, the vertebral column. It's 26 irregular bones. If you counted all these guys up, that would be 26. Now, before we get into specific bones, we're going to talk about every single one of them. And well, kind of. We're going to talk about them in groups. But before we identify them in different groups, it's important to understand like the general features of a vertebra. And once you understand that, kind of the basics behind the structure and the archetype of a vertebra, then understanding the different types is a lot easier. So here I share with you the general structures of a vertebra, if I can. I can advance on with button to push. Anyway, first thing I have is the centrum. The word centrum, or sometimes it's called the body of the vertebra. It's the large, round, kind of weight-bearing portion of the vertebra. That's the portion of the vertebra that contains intervertebral discs, you know, the discs that are between the vertebrae. They'd rest right there. Remember, it was made out of fibrocartilage. Remember all that? So there's two main parts of a vertebra, the centrum, or the body, and then everything else that's attached to the top of it, like this, right here. All that up there is called the vertebral arch. Now, in turn, the vertebral arch has two parts. There's a lamina and a pedicle, or pedicles, I should say. Lamina means like plate, so it's like this top kind of perpendicular portion right here that supports processes. You have two transverse processes that stick out, and then a long spinous process that sticks out dorsally. Like if you run your finger down somebody's back and you feel the bumpity bump going down the center of your back, that's what you're feeling, the spinous processes of the vertebral arch, okay? Now, there's all that, and then what actually connects the lamina to the centrum would be the pedicle. The word pedicle, ped, like foot, feet. Pedicle means like little feet, like little feet. Like it almost looks like, to me, what it reminds me of is like the legs on a table, like a card table. The lamina would be the flat part of the card table, and the pedicles would be the legs, you know. And so these two things together, they're kind of perpendicular to one another. The pedicles are coming up, laminas across. That makes the vertebral arch. And the whole idea is to surround the spinal cord, which is going to be in this space right here, which is the vertebral foramen, okay? And so I next define the vertebral foramen. It's that space between the centrum and the vertebral arch. Of course, that's there to accommodate the spinal cord, like I said. So of course, your brain and spinal cord are there first, and this bony stuff kind of forms around it. So that's how it happens, okay? Now, often you hear vertebral foramen, you know, vertebral canal, vertebral cavity, you know, what are the differences between these things? Or are they the same? Are they synonymous? Well, kinda. What the hell to do with this thing? Okay, I'm just gonna put it right there for now. And then I got someone coming in late. All right, there we go. Well, the whole, and just a single vertebra would be the foramen. Remember, it's for the passage of the spinal cord. Now, on articulated vertebrae, if they have them all together, it form like a long hollow tunnel, which is actually the part of the dorsal body cavity you call the spinal cavity or vertebral cavity, okay? Or it can be called a vertebral canal. So the vertebral canal or the spinal canal or spinal cavity is that space that's formed by articulated vertebrae. Does that make sense? How they're all together? So they're all kind of the same, kind of different. It just depends how you're looking at them. Okay. Advance. There are also intervertebral foramina, or singular would be intervertebral foramen. That's just one hole right here. Now, if you look carefully, of course, this is 3 vertebrae that are articulated, all right? Of course, this is superior, this is inferior, this is up towards the head, this is down, you know, towards the pelvis. And if you look on the superior surface, you got like a little notch right here. On the posterior surface, you got a little notch right here. And notice the superior or the inferior kind of articulates the superior of another one. And it makes a hole right there. You see how that does that? So these notches produce this opening. So what's so great about that? Well, that opening in that space, that's in the dorsal body cavity. That's the spinal canal, okay? In that space that's in there. So, well, what's in there? Well, the spinal cord is in there. So, well, as the spinal cord is descending down the dorsal body cavity, the spinal cavity, it emits or gives rise to spinal nerves. And so the intervertebral foramina are for the emergence of spinal nerves. And so that's what these holes are there for spinal nerves to pass. And when we study the nerves, you'll know that's where they are and where they come from. Now, for the regional groups, the different types, we have 1, 2, I gotta like count like this. I think it's 5. 1, 2, 3, 4, 5. Yeah, 5. You got 30 years doing this, I would know that. I know it. The ones in your neck, the first 7, they're collectively called cervical vertebrae, and they're all named. And I mean, you should know all the names. Oh my gosh, that's too many to know. Well, the names are pretty easy. They're just shorthand for the cervical vertebrae is C sub 1 through C sub 7. That's it. You know, those are the cervical vertebrae. Now, identifying which one is which is a little bit more difficult, and that's beyond the scope of this course anyway, except for a couple of them, and I'm going to share that with you in a minute. So here I'll tell you that the first 7 are the cervical. They're all, of course, they're all in the neck. And that's what cervical means. Remember, cervix means neck. Cervical means of the neck. So these are the ones in your neck. And, you know, that would be easy to see on an articulated skeleton. You go, well, you figure out where a skeleton is. Look, there's the skull, and you see where his neck is. And so you count, there'd be 7 of them in his neck. But could you identify a disarticulated cervical vertebra? Sure, you could. If you look, pick up that vertebra, and you see, obviously, the big, large hole right there, that's the vertebral foramen. But if you see 2 extra foramina, basically in the same position where the transverse processes would be located, those are called transverse foramen, okay? So if a random vertebra possesses transverse foramen, it is a cervical vertebra. And in the human skeleton, all 7 possess transverse foramen, and only cervical vertebrae in humans possess transverse foramen. So there you go. So that's like in my lab, when we used to be hands-on in the lab, that was part of the challenge for my students, is to just identify just kind of random vertebrae. I have a big old box just full of just like dozens of vertebrae. And if you just pull any one of them out, you should be able to tell me what type it is. And I tell them it's a real easy thing to do is if you look and see those extra foramina, you know it's one of the ones that go in your neck, okay? So there's that. And then of the 7, the first 2 are special. These are the only 2 that I would want you to really know to be able to isolate, because these 2 are very special. Their morphology is kind of shifted somewhat compared to the other 5, you know, C3 through C7. C1 has a special name. They call it the atlas. You can see right here, this is the first one right here. The atlas, that's functionally, it's the vertebra that allows your head to nod, okay, move like this. And then C2, it's called the axis underneath it. It allows the head to pivot, in other words, like turn from side to side. So how is that? What's so special about these? Well, this was an innovation that took place in the evolution of the tetrapod skeleton, or the tetrapod vertebrae. These first 2, what happened is that in non-tetrapods, basically fish, C1 just had a centrum just like this, and then C2 had a centrum like that. So basically, the fish didn't really have a neck. If you think about fish don't have a neck, do they? Fish can't look around like this or do like that. No, only tetrapods can do that. Frogs can do it a little bit because their neck is just really short. They just have an atlas and axis, and that's it. But what happened somewhere in the millennia, a mutation occurred. And the mutation, what happened is that the C1's ossification center for the centrum got shifted, and it fused with C2. And so basically what happens is the atlas, the first one, doesn't have a centrum anymore. Its centrum is stuck to the centrum of C2. And if you look carefully, you can kind of see this bony structure sticking up. They identify it as the dens. See that? The dens is a process on C2. And what happens, it allows these two bones to kind of rotate and pivot and nod. And so that's a good thing, because now for the first time the animal can move its head around and help access resources and look around and hunt and eat and whatever better. So anyway, but we have that, and of course we have more cervical vertebrae, so we have a longer neck. We can move our head and neck a lot more. But these are the first two, the atlas and the axis. They call it atlas. Why would they call it atlas? You know, the Greek deity Atlas. You ever seen a picture of a guy holding the world on his shoulders? You ever seen that guy, that Greek? That's Atlas. You know, everybody knows Atlas. He's the guy that's got the world on his back, you know. And so I guess the analogy here is that this one has the skull on its back. The skull was like the world, I guess. I don't know. And axis, if you're talking about a world or a planet or some kind of something like that that spins, you know, North Pole, South Pole, axes, spins. Well, that's what the C2, the axis, does, allows the head to spin somewhat. You know, of course, you can't spin it all the way around like Linda Blair and The Exorcist. You ever seen that movie? Scary. Anyway. So that's cervical vertebrae. The ones in the neck. So after the neck, you have 12 more. And these next 12 are all different. And they're just simply referred to as the thoracic vertebrae. Remember, thoracic means of the thorax. The thorax is your rib cage. So thoracic, those that have ribs attached to them. There's 12, and they're just named T1 through T12. They don't have any really special thoracic vertebrae that has special names or anything like that. But I guess the most noteworthy feature is that they have processes on them that you can see for ribs to attach. And those processes are called rib facets. See, attachment sites are called rib facets. And so if you find a vertebra, no transverse foramen, so it's not a cervical, right? But it has rib facets, it's got to be one of the ones that goes in the thorax. So there you go, thoracic vertebrae. They typically have long, pointed spinous processes. And they have a reflected transverse process. They have kind of angled back like that to compensate for ribs to come in and attach. But there's usually two attachment sites, one on the centrum right here, and then one on the transverse process right there. When we look at the ribs, you'll see where they actually attach. So there's that. After the T12, you get down into your lower back. And in your lower back, there are no ribs. So these next 5 are the lumbar, L1 through L5. No special names. They're just the ones in your lower back. And of course, from cervical down, you know, towards the pelvis, they're graduated in the sense they get bigger and bigger and bigger and bigger. So these are large of the ones above it. These are the big ones. These are large weight-bearing centra, heavy duty, okay? They don't have ribs attached to them. Basically, what you have here, these little processes sticking out, or where ribs would be, but they're just little short, little stocky little processes. The spinous process is short, not real long. You don't have long, pokey things in your lower back, okay? That's basically it. Usually I tell students in lab that are, you know, trying to learn the vertebrae, if you're just reaching in a box of random bones and you pull up a vertebra and you're trying to figure out which one it is. Is it cervical, thoracic, or lumbar? Always ask yourself 2 questions. First question, do I see transverse foramen? If you do not see transverse foramen, it cannot be cervical. Second question you ask, Do you see rib facets? Do you see the little attachment sites for ribs? No, you don't. So no rib facets, no transverse foramen, has to be lumbar vertebrae. So but those are the first three. Those are the first three groups that are articulating vertebrae. The fourth and fifth group, they're easy. You won't only be able to confuse them because they're all fused. And that's what I'm going to show you here. The fourth type of vertebrae, they're collectively called sacral vertebrae. There's 5 of them, and they're S1 through S5, but they're all fused together as one unit. So in your 206 bones of your body, this is only considered one bone, okay? And the name of this bone, which is formed from 5 different vertebrae, it's called the sacrum. And so this is what you're looking at. It's the anterior view of the sacrum, this posterior view of the sacrum. And if you look carefully at it, you can see that, oh yeah, it's just vertebrae that are fused together. And of course, the anatomy of it is a little bit different. So that the structures or the features of it, the names have changed somewhat, but it's basically the same thing. The features include sacral foramina. So they see all these holes. There's like 4 pairs, 1, 2, 3, 4. Basically, what the sacral foramina are the intervertebral foramen. You remember all the other vertebrae have intervertebral foramen. Remember I told you where they come together and form a hole? Okay, well here they come together and they fuse because they got the openings. These are where sacral spinal nerves would emerge, okay? There's also the sacral crest, that you can see posteriorly right here. Basically what the sacral crest is are fused spinous processes. Remember spinous processes, that center median structure that sticks off the lamina? That's what you got there. That's what forms the sacral crest. And then the alae, look here on the sides, see the flared out portion right there? That's just spinous or transverse processes. They're all kind of fused. These are the alae, so those the sides there. And then this is a kind of a special feature, the sacral hiatus. What's a hiatus? You heard that word before, that term? Who uses that? Not too many people in everyday speech. Oh, hiatus this or hiatus that. What I think of when I think of the word hiatus in everyday speech is like an intermission. Like you're watching a long movie like Gone with the Wind or something like that that's like really long, and they actually have an intermission, a break. Or if you're watching a play and they have an intermission, that's a hiatus, okay? So what's our hiatus here? Well, the hiatus is an S5. Remember S1 through S5? S5 is missing its lamina. What? Yeah, it's gone. So there's a hole right there. That's your sacral hiatus. And what happens is that you actually have 31 pairs of spinal nerves, and the 30th and 31st pair emerge from this opening right here. When we look at the nerves, you'll see that, but that's basically what it is. That's the end of the spinal cavity. And of course, the last nerves are going to emerge right there. So there's that. That's your sacrum. And then the last vertebrae after the sacral vertebrae are the coccygeal vertebrae. Coccygeal in any other vertebrate are called caudal vertebrae. Caudal means, you know, the tail. But apes don't have a tail. You know, how you tell from hominids. Well, none of your hominids have a tail, or I guess, what am I thinking about? Well, you can tell a monkey from an ape. Monkeys have tails, apes don't. But we used to, developmentally we did. This is kind of a vestige of our tail. In early development, all vertebrates have a substantial tail, but it's reabsorbed. And so it's almost 100, it's not 100% reabsorbed. This is what's left. And here you can count, looks like 5, 1, 2, 3, no, it looks like 4 right there. This one looks like 5. This is the angle I'm looking at. 1, 2, 3, 4, 5. It varies. Almost everybody has at least 2. Some people have 3, some people have 3 or 4. It just depends. you rarely have an individual more than 5. If you start having more than 5, like 6, 8, 10, 12, then you're born with a tail. I mean, you actually have a tail. And my dad has delivered babies with tails before. And, you know, you probably heard of things like that. You ever saw that movie, what was it, Shallow Hal? Remember that? It's kind of a long time ago. That was the individual in the movie that had a tail or something. Anyway, Google human tail. A baby's born with tails or whatever you see. And that's called supernumerary caudal vertebrae, which is not an unheard of thing. But anyway, you're not supposed to have one. It's reabsorbed because apes lack a tail. But the remnant, the vestige of our caudal vertebrae, whether it's 3 or 5 or whatever, that's fused together like the sacrum. And it's considered one bony element of the skeleton. So of the 206, this skeletal feature called the coccyx counts as 1. So you have 1 coccyx or 1 tailbone. That's it. And again, like I said, it's like a little vestige, a little vestigial structure of your skeleton that we don't really use. It's not functional. Doesn't do anything but give people problems, I guess. I'm trying to think of sports injuries. Do you know which athletes suffer the most broken tailbones? Anybody know? It's like, you know, there's certain athletic events that you have commonly broken bones. Like bull riders, their most common broken bone is the clavicle. And football players, it's I think like the fibula, and so on and so forth. The coccyx is most often broken in cheerleaders. That's what I always think of, the cheerleader bone. So how do cheerleaders break their coccyx or their tailbone? You ever thought, how do they do that?
They get dropped.
Yeah, when you drop, when they fall on their butt, yeah, they flip flopping across the gym floor, and they flip flop a little bit too much, and bam, they land on their butt. Oh, my butt. Yeah, you think about that. I mean, this little bitty bony thing, you land square on your butt real hard, you can snap it. Yeah. So anyway, it's the cheerleader bone. I don't know. So I always think of cheerleaders when I think of that. Okay. I included a little verbiage right here. Although considered one bony element of the human skeleton, the coccyx contains 3 to 5 caudal vertebrae fused into 1 to 3 segments. You know, it's usually like this. Like almost everybody has this one right here. This is the first one segment, and all these little bitty guys that are kind of tapering off and just kind of one segment. But that's it. Those are all your vertebrae. Now, you have more of your axial skeleton. Remember I said early on that this thing right here in the center of your chest, in this class, is going to be considered axial instead of opposed to appendicular. That's a whole nother lecture in a different class where I talk about this being actually appendicular. But anyway, it's part of our axial skeleton in here. The word sternum means strown. Don't ask me why they call it the strown bones. Like, I guess because it kind of looks like somebody grabbed some pebbles and threw them. They were strewn, like they were scattered out. Now, in the human skeleton, it doesn't look like, but any other, I guess, primitive tetrapod, these would just kind of look like some just scattered little bony elements that are kind of connecting or uniting the ribs, okay? But in mammals, it's kind of modified somewhat. And so here we have this kind of big bony element here. It's considered just one bone of the human skeleton. So again, of the 206 bone, the sternum would be just one. Now, it does have 3 parts we identify. There's 3 fused elements, which are collectively referred to as sternebrae. That's the strone things. Remember I said I talked about in a primitive tetrapod skeleton, they would have several of these, almost one per pair of ribs. But you can see our ribs are changed. This is a mammalian thing where you get the ribs are kind of tapering off. Well, the sternobrae kind of taper off until you end up with just like these three bony elements right here. But the first one is right here at the top. It's called the manubrium. What's manubrium mean? It's like little man or something like that, or man shield or something. It doesn't look like a breastplate, like something. You can almost see that. I guess it's kind of like a breastplate, isn't it? But as a part of the skeleton, it serves to act as an articulation site for the clavicle. See, here's your collarbone here, collarbone here. The collarbone rests. There's two little divots on top of it that supports the collarbones. And the first two ribs articulate with it. So manubrium articulates with the clavicles and the first costal cartilages. Because if you look carefully, you got ribs in the background, but you got two parts of your ribs. You got the cartilaginous part. This is all the white looking bluish white stuff. That's all hyaline cartilage. And of course, it's like hyaline cartilage. It's like an extension of the ribs. So it's really only cartilage that fuses with the sternum, but the costal cartilage. But anyway, this one was associated with the first rib. The second part, it's called the gladiolus, like from here down to here. Or some books will call it the body of the sternum. I like gladiolus because it's more like man shield again, like when would men use a shield, like gladiators, get it? Like the gladiator, if you fight with a shield and a sword. And actually, I think gladiolus, I think it refers to a sword, because I guess it kind of looks like a sword or something like that. Maybe the handle on a sword, perhaps. Anyway, or the body of the sternum, that's fine too. What does it do? Well, it receives articulating sites for the next, let's see, 6 ribs. Ribs 2, 3, 4, 5, 6, and 7. Okay. And you can see they have 6 pairs of articulating facets associated with it. See one of these in person, they'll have little divots for those. Well, I thought we had 12 pairs of ribs. Well, you do, but not all of them attached to the sternum, just the first 7. Okay. So there you go. You got the manubrium and the gladiolus. And then finally, the third element of the sternum, this little bitty stalactite sticking down right here. You see that? That's the xiphoid process, or the xyphosternum, or the inceniform, all the same thing. Xiphoid. Xiphoid is another. It's a little dagger. You're like, what's the word? Where does the word xiphoid come from? That's another like gladiator kind of weapon, like a point. Because you look at it, it kind of looks like a pointed knife, doesn't it? Like a sword, little pointy thing. It's again. Remember I said the whole sternum itself in mammals is kind of like tapering off where you don't really have a whole lot. And you can see the ribs are kind of doing that too. And so this is just a little vestige of one of the last sternobrae that are kind of forming there. Nothing articulates with it. It's just kind of there, kind of creates trouble. It's another one of those things that are like, who breaks their xiphoid or xiphoids? You know how this one is most often broken. I don't know if that's the most often broken, but they always warn you about breaking this. They say, you've got to be careful doing something because you'll break the xiphoid process. What are we talking about? Huh? Yeah, it's CPR. When they talk doing chest compressions, they say always, before you do chest compressions, palpate the torso, feel the ribs, come up to here, put your hand down right there, and then do compressions above your hand. So you don't push on that and snap that off. This is one of the last items, if not the last item in your body to ossify. It does not turn, it's hyaline cartilage when you're born, and it's hyaline cartilage through your teens and 20s. And I think it's not really fully ossified or turned to bone until you're like up in your 30s or 40s or something like that. This is one of the another ways you can age a skeleton. It's by how bony the xiphoid process is. You can see it right there. But the human skeleton is just considered a vestigial structure. So there it is. There's your sternum. Now for the ribs. Ribs, 24. That's 12 pairs. Get it? 12 pairs. Why do you have 12 pairs? Because you have one pair per thoracic vertebrae, right? How many thoracic vertebrae do you have? Well, 12. And each of the 12 has a pair. So 2 times 12 is 24. Is there a math requirement for this class? There should be. That's kind of an easy one. But I got to ask you, I ask this question every semester. Is that a trick question? How many ribs do you have? Because doesn't it vary from one gender to the other? Do the sexes, both sexes have the same number of ribs? Don't know? They don't? You don't think so? She goes, because Adam and Eve. Yeah, you know, when I was in high school, way back a long time ago, high school teachers actually taught us that. He says, yeah, we had a skeleton in the lab, and she goes, yeah, that's a female skeleton. Count the ribs, and we counted, and he goes, oh, there's 12 pairs. There's 24. Yeah, it's 24. It's a female. If they had 23, it'd be a male. So, oh, okay. So that's what she taught us. And we just kind of plodded through life thinking that, you know, guys have one less rib than females. Is that true? And it's not true. It is true. And I have students, you know, on occasion, not every semester, but on occasion, students argue with me and say, it's in the Bible, Adam and Eve, you know. God took a rib from Adam and made Eve, and he has one less rib. I said, okay, just for argument's sake, let's assume that this story is true. The events in Genesis all took place and it's all legit. Okay, so Adam has one less rib, and Eve has 24 ribs. So why would Adam's descendants, and only his male descendants, inherit one less rib? That doesn't even make any sense. So no, that does not happen. Yeah, you can't do anything to your body and make it heritable. That you learn that in a biology class. It's called the inheritance of acquired characteristic, is an idea that was brought about by a guy named Lamarck, and that's what he taught us. And yeah, your body, you change your body, and then you make that heritable, and that's how things evolve. But Darwin came along and said, no, that's not how it works. So the inheritance of acquired characteristics is wrong. So there's nothing you can do to your body that you can, you know, pass it on. Like, for example, if Lamarck's idea was true, then you would only have to clip the ears and crop the tail of the first Doberman. You know what a Doberman pincer looks like? It's pointy ears and a short tail. They're not born like that. They're not. No, you have to clip a dog's ears and his tail, because all dogs, that species, they're all born the exact same way, with some weird exceptions. You know, well, but what about a French bulldog? Don't tell me about French bulldog. They're freaks of nature. But anyway, but Lamarckism doesn't work, because if it did, you would only have to do the first Doberman like that, and then its puppies would be born like that. But no, it doesn't work like that. And thank goodness it doesn't work like that, because you could, you know, how else would you explain this baby that's born with a tramp stamp? You know, oh, my baby's born with tattoos. Well, see what it's heritable. See what you did to your body? You can pass that on. Sorry. Anyway, no, you can't do that. And so both sexes, the point is, I'm not trying to shoot down the Bible or anything, but it doesn't say that in the Bible. That's one thing. No, it does not say that males inherit one less rib. So that's not even true. But that's okay, because in the normal human skeleton, both sexes have the same number of ribs, and it's always a pair, okay? Assuming that they have 12 thoracic vertebrae, you know. So it doesn't matter. A vertebra would not be a vertebra if it didn't have ribs attached to it. Because it is true that you can have 6 lumbar vertebrae and only 11 thoracic vertebrae. So how does that happen? Well, it didn't develop ribs for one reason or another. But anyway, most human skeletons, 7 cervical, 12 thoracic, 5 lumbar, and then the sacral and coccygeal, whatever. So back to the ribs. What about the anatomy of the ribs? Well, the anatomy of the ribs is pretty simple. I'd say the head of the rib articulates with the centrum. That's this end right here. See the head? The tubercle, that's another bone term. You got these bone terms like fossa, foramen, and there's going to be others. But the tubercle is usually like a raised bump. And look at that raised bump is where the rib articulates with the transverse process. So this is all on the head end of the rib, okay? Then it swings around, it's headed towards the sternum, okay? So the sternal end is the end that develops costal cartilage, and then of course the costal cartilage in turn connects to the sternum. And it's usually pretty truncated, like a sharp, you know, see it squared off right there, because that's where the costal cartilage would take over right there, okay? Now, there are types of ribs, and I would want you to know this, although, yeah, just know the different types. There's 3 basic, well, 2 basic types, and then there's subtypes. You don't always do that. You have true ribs and false ribs, right? There's always true and false things. And what makes true ribs true ribs? Well, something's true, like true blue, unmodified, ancient, most primitive, that kind of thing. That's what we're talking about. Only the first 7, because if you look at the entire rib cage, the thorax, you see how they look normal, and then they kind of changing. And so as you're moving more inferiorly, or in a quadruped, it'd be caudally, you know, towards the posteriorly, I guess. The ribs are kind of like tapering off, as well as the vertebrae, et cetera, et cetera. But the first 7 are unmodified. Those are the primitive ribs, the true ribs. They attach directly, 1, 2, 3, 4, 5, 6, 7. They attach directly to the sternum. And that's what makes them true ribs. And they're also called vertebral sternal ribs, from the vertebrae to the sternum, period, okay? Only the first 7 do that. So you got 12, and the first 7 are true ribs, then 8 through 12 have to be false, right? And they are. So 8 through 12 are false, but you have 2 different types of false ribs. What makes them false? Well, what makes true true? I mean, they're true because they attach to the sternum. These are false because they don't. How do they attach, or what do they do? Well, it depends on which ones you're talking about. Ribs 8, 9, and 10, see 8 through 10? These are called vertebral chondral ribs because their sternal ends, the costal cartilages, kind of come together. See how I can't point to it. 8, 9, and 10, that comes together, fuses, forms one cartilaginous element that kind of piggybacks off the costal cartilage of rib 7. You see that? So it's between the vertebrae and the cartilage, opposed to the vertebrae and the sternum. So you go from vertebral sternal to vertebral chondral. So there you go, vertebral chondral ribs, or ribs 8 through 10. They don't have a direct connection to the sternum. They connect indirectly by way of costal cartilage number 7. Does that make sense? And then The last two, 11 and 12, those are the ones in the background that just kind of looks like they're floating back there. The floating ribs. Looks like they're kind of suspended in space. If you look at an X-ray, it's like they're not doing anything. They're just sitting there. These are vestigial ribs. If you look at the rib cage as a whole, of course, you're missing ribs. Ribs are the 5 lumbar vertebrae originally had ribs in a primitive tetrapod, a primitive vertebrate, I should say. But that's going from non-tetrapod to tetrapod all the way up to mammals. You see a change in the rib cage. And so these are kind of just little vestiges of ribs that are kind of left over. The only thing they attach to are the vertebrae. So 11 and 12 are just called the vertebral ribs, or you call them floating ribs if you want, but vertebral and floating are the same thing. They lack a sternal articulation altogether. All right, does that make sense? Because they're kind of puny little things. Okay, hey, you know what? That's the axial skeleton. Now we're going to talk about bones of the appendicular skeleton, bones of the appendages, the arms and legs. I don't know how far I'm going to get, maybe just through the arms, perhaps. So we'll start with the cranial extremities, shoulder girdle on out to the fingers, and then do the caudal extremities. Cranial extremities, 64 bones. I guess I counted these up. 64 bones altogether. The first 4, 2 pairs would be 4 bones, right? Would constitute the pectoral girdle. Okay. The pectoral girdle, and this is true for all mammals, they're the exact same way. There are 2 bones that form the pectoral girdle, 2 pairs of bones. Your clavicles and your scapulae. Your clavicles, those are your collarbones. And that little S-shaped bone right here. That's the number 1 bone, broken bone in the body. And I said it's bull riders break that a lot. So what happens to bull riders? What are bull riders? What happens to bull riders? They're riding a bull, and what happens? They fall off the bull. Well, you can break your collarbone and not have to ride a bull, right? How do most other people break their collarbone? Basically the same way. They're falling. Yeah, it's the of all the bones in your body. If you took like look at all the number of broken bones that happened last year, all the different types of bones are broken. There's gonna be one bone that's broken more than others. It's gonna be the clavicle. And in most instances, what it causes the break is a fall. When this person is falling, because when you fall, what do? You put your arms out. You're flying off a bull. You want to catch yourself, right? Or if you like slip, or like somebody doesn't know how to, they're roller skating or they're ice skating and they don't know how to stop. You're headed toward a tree or a wall. You put your arms out, right, to stop yourself. What's that mean? Well, you look at your collarbone. It's connected to your shoulder blade, and the shoulder blade is connected to your arm. And so your arms, the entire arm, its articulation with the axis rests on this one joint right here where it articulates with the manubrium, okay? And if you lock your elbows, that compressive force that's being shot through your arm, through your elbow, to your shoulder is transferred to your manubrium right here. Now your clavicle is S-shaped, like a spring. It gives a little bit. It kind of bends, but it doesn't. It's not compression proof. I mean, it can snap, and that's usually what happens. But there it is. It's for articulating your arm to your axis right there, and that's where it takes place. Here I tell you, it articulates between the manubrium. Of course, that's the first part of your centrum, and the acromion process of the scapula. You can barely see it in the background there. Here's your shoulder blade, the big triangular bone. There's a little process sticking out right here, sticking out right there. That's to accommodate the clavicle. It's called the acromion process. There you go. Here they actually identify the joint, the acromioclavicular. Acromioclavicular, that's a mouthful. Acromioclavicular joint. It's just basically where the acromion process and clavicle come together. Okay, so there's that. And then, of course, the scapula, that's your shoulder blade, big triangular bone in the back. I guess the most noteworthy thing about the scapula, in lab, there's all kinds of other detail I'm going to share with you, but in lecture, the only thing I want you to know is this right here, the glenoid fossa, sometimes called glenoid cavity or the glenoid process. I like to call it a fossa. Remember, it's like a depression. The word glenoid just means socket, but you have all kinds of sockets, but this is your shoulder socket, this nice smooth surface right here on the shoulder blade that receives the head of the humerus. That's your upper arm bone articulates right there. That's basically your shoulder socket per se. And if you look at it, it's suspended by musculature in the back. There's no articulation with the axis anywhere else. Its only articulation is with two bones, the humerus distally, and then proximally would be the clavicle, and that's it. It's kind of just sandwiched between the two. It doesn't connect with any of the ribs or anything in the back. Sometimes people think that it's connected. It's not. It's just suspended by a lot of back musculature right there. But anyway, there's your pectoral girdle. Now, from there, we're just going to move on to the sections of the appendage and identify the bones. Now, I'm showing you pictures, and of course, they're pointing out all kinds of stuff. Now, all this stuff that's being pointed out, that's, in my mind, lab stuff. So don't worry about that. I mean, if you want to learn it, you can learn it for lab, but I'm not going to ask you about that. The only thing I'm going to ask you about in lecture is the stuff that I talk about and the stuff that I include on my PowerPoint, okay? So there's that. But I want you to know what the brachium is. Remember, the brachium is that initial segment of your upper arm, or basically everything between your shoulder and your elbow, your brachium. There's only one bone in there. And that one bone is called the humerus. That's all you need to know. Okay, now, the detail and the anatomy of the humerus we'll do in lab. But for lecture, that's it. The next segment of your upper appendage is your forearm, or the antebrachium. Remember that? Antebrachium. And remember, the antebrachium, between the elbow and the wrist, there are two bones, the radius and ulna. Now, you should know which one is which. There's a lateral one and a medial one. Remember the anatomical position, standing in the anatomical position? You see me doing that? Anatomical position. Palms forward. Remember, your thumb is laterally and your pinky is medial. All right? The radius is always on the thumb side. So the radius is going to be lateral. And so the radius is lateral, I mean the ulna is medial. So it's on the pinky side. And you can kind of see them right here. This is up here like where the elbow would be. And then down here is where the wrist would be. So you got your ulna right here and then your radius right here. This is actually a posterior view of the right arm. Radius and ulna. What else? Thumb side, disc-shaped head. The radius of this disc-shaped head, because if you look at your radius and your forearm, you could do this, right? You can't do your feet like this. Can you do your feet like this? No, you can do your feet like this. Look at one side of your foot, and then, hey, look at the other side of my foot. You can't do that, can you? Try it. You can do that because the radius actually moves. Your tibia and fibula do not move. They don't move like that. What allows it to move like that is see the head on the radius is nice disc shape, and it moves. And so the radius actually, when you pronate, I don't know if you can see me doing this. Pronate your hand. It's called pronation. It's called supination. You pronate, do that. The radius crosses over the ulna. So in the anatomical position, the radius and the ulna are parallel to one another. But when you pronate your forearm, the radius crosses over the ulna. The ulna does not move. Only the radius moves. There you go. All right. So after the forearm is the hand. or the manus. In anatomy, we call the hand the manus. Okay, the manus is divided into three groups. There's the carpus, metacarpus, and then the superior digits or the fingers, the phalanges. The carpus, there are carpal bones, and the metacarpus, there are metacarpal bones, etc. What would, of course, come immediately after the forearm would be the carpus or the carpal bones. There are 8 carpal bones per wrist. And the 8 carpal bones, they're arranged in 2 rows of 4. So 4 and 4 is 8, right? You have a proximal row and a distal row. Remember, distal is further downstream, closer to the fingers, and then proximal will be closer to the forearm bones. And so you can see this green, 1, 2, 3, 4 green ones, and then 1, 2, 3, 4 purple ones, okay? The proximal carpal bones include the pisiform. Remember we talked about the pisiform. Pisiform is a sesamoid bone. Remember, it's like your kneecap. It's suspended in a tendon. It's one of, we include that in the 206 bones because all mammals have a pisiform in some place, and of course all humans do, but that's a special sesamoid bone. So the pisiform, okay, little big guy right here, the purple ones, pisiform, and then next to it is the triquetrum or triquetruate or triquetrual. If you don't like any of that, just call it the triangular because that's what the word means. Triquetrum, triangular, same thing. It has like 3 sides. Then there's the lunate. Lunate means little moon because it's a little crescent-shaped bone. And then the scaphoid. It's of the 3, it's the big one. That's the one that actually articulates with the radius. Older books might call it the navicular, okay? But you have 2 naviculars. You have one in your ankle, so to avoid confusion, they usually refer to this one as the scaphoid. But there you go, pisiform, triangulum, lunate, and scaphoid. And then the 4 distal bones out from that, the hamate. Hamate means has a hook. It actually has a hook on it called the hamulus. You can see right here the little hamulus right there. Kind of a neat thing. The capitate. It's the big one right there. And then trapezoid and trapezium. Older books might call the trapezoid the multangular, and then the trapezium the greater multangular. Okay. There you go. Now, in lab, you'll be challenged to identify, one from the. In lecture, I'm not going to say, point to them and ask you them. But you would need to know, which ones are proximal, which ones are distal, which order they occur in. You should know that the hamate's next to the capitate and the trapezoid, trapezium, and so forth. And so learning them in order like that. There have been mnemonics provided or presented to students to help them memorize the 8 carpal bones in order, like taking the first letter of the name of the bone and applying it to a little jingle, like starting with the scaphoid, saying students like their professors to teach complex hypotheses. Wait, let me write that down again. There's others. I'm going to share some others with you. Some of them are kind of strange. So there's that one, and there's Sally left the party to take Charlie home. Kind of weak. Or Dr. Vidrine's favorite, scared lovers try positions they can't handle. What? Or one my dad taught me, using the old school terminology with navicular, greater multangular, and multangular. Never lower Tilly's pants, grandma might come home. I remember he taught me that when I was like in 3rd grade. I said, what, Tilly? Who's Tilly? Why would you take her pants down? I didn't get it at the time. He said, don't worry about that. Just learn the bones. So, okay. Anyway, well, there's a Mr. Williams. And the reason why I'm just kind of breezing through this because there's a Mr. Williams one, and that's the one I like the best. And because when I studied the wrist, I always studied it like this, like an anterior view of the right hand, like this. Here, you're kind of using all those other mnemonics. You're kind of counting backwards, reading from right to left instead of left to right, and from bottom to top. And when I was in grad school teaching this, my students in the lab said, teach us the mnemonic that goes with the wrist bones. And I said, the students like their professors to teach complex hypotheses. And they go, no, that sucks. They said, that's just as complicated as learning them outright. So maybe that's the purpose. I don't know. Anyway, I didn't like that. My students didn't like it. They said, come up with another. They said, put me on the spot. And actually, I did this like almost 30 years ago or whenever. And I've still been using it. My students still use it today. And to me, it's easier because he started the top row, read from left to right, and then come down underneath this, and again, left to right. And I always liked started with this one. Now, this is on the pinky side. Right? This is the pinky side. Here's the thumb. This bone right here, notice that there's 4, 1, 2, 3, 4 distal carpal bones. Only this first one right here supports 2 metacarpals. Notice that. So it's the only one. That's important because when you have a hand, like in lab or whatever, and you're trying to like learn the bones of the hand, look for that. Look which one has 2 bones attached to it, 2 metacarpals. The 5th and 4th metacarpal. Only the hamate does that. So I like to start with the hamate, the one with the hook. It also has a hook on it called the hamulus. And I said, Henry caught 10 turtles. Henry caught 10 turtles. I'm always thinking about critters, you know, remember I'm a zoologist. I'm always thinking about snakes and turtles and lizards and frogs. So Henry caught 10 turtles plus 3 little snakes. That's Mr. Williams' mnemonic. Henry caught 10 turtles plus 3 little snakes. The plus, P for pisiform, because that pisiform is like a little addition. Get it? Plus. It's a sesamoid bone. In another class, when I talk about the evolution of the carpal bones, we call the sesamoid, or we call the pisiform the ulnar sesamoid, because it's a sesamoid bone associated with the ulnar. Okay. Anyway, sesamoid bone. Plus 3 is in triangle. Get it? Little like a little moon. And a scaphoid. I don't know just what scaphoid means, but Henry got 10 turtles plus 3 little snakes. Now there's 3 T-bones: trapezoid, trapezium, and triangulum. You just have to remember those in order. Trapezoid articulates with the 2nd metacarpal, and the trapezium articulates with the 1st metacarpal, the one that supports the thumb. Anyway, there's that. And those are your 8 carpal bones. What's next? Well, next is pretty easy. Bones of the metacarpals, or the bones of your palm of your hand. And that there's 5. Counting from over here, your thumb is your first digit, number 1. Remember, we talked about this before, I think. Your second digit is your index finger, your pointing finger, and of course your middle finger's number 3. It's hard for me to do this one. Your ring finger's number 4, and your pinky finger's number 5. And the carpal metacarpals are also numbered, and of course the number is associated with the digit number. So this first metacarpal is metacarpal number 1, metacarpal number 2, 3, 4, and 5. That's it. Pretty easy. Okay. And the bones of the fingers or the phalanges, they're done the exact same way. But look at them. Bones of the superior digits, your finger bones, 14 per hand. You have 5 fingers, right? 14 is not a multiple of 5. So there's a discrepancy, and the discrepancy occurs in your first digit, your thumb. See how your thumb, see me doing this? See you guys doing that? All your other digits go up, over, and down. See, up, over, and down. But your thumb only goes up and over. Doesn't go down because it's missing a phalanx right there. So that's your discrepancy. Look right here. There's a distal phalanx and a proximal phalanx. So this is called distal phalanx 1, proximal phalanx 1. All other digits have 3. See, 1, 2, 3, 1, 2, 3, 1, 2, 3. 3, 6, 9, 12, 13, 14 total. The middle one is called the middle phalanx. But how do you distinguish phalanges from one another? Well, you put the digit number. So this bone right here, this is the middle finger, right? And this bone right here would be called middle phalanx number 3. This one right here, distal phalanx number 4. This one right here, proximal phalanx number 5. That's how you number the bones of the fingers. And really, that's how we're going to see, that's how you're going to, exact same way you name the bones of your toe bones, exact same way. You have 14 toe bones per foot. And there's a proximal and distal phalanx 1, and then a proximal, middle, and distal phalanx 2 through 5. Hands and feet, similar. That's a great place to stop. 5 minutes to spare. And so, what's today? Tuesday, Thursday. You know what we're going to do Thursday? We're going to do the cartwheel. We're going to finish all this up. May or may not start the muscles. And then, gosh, it's going to be, before you know it, time for your second exam already. Look, when did I say your second exam is going to be? The 11th? Huh? I didn't say? Just, oh, it's next week is midterms. Yeah. Well, yeah. I mean, your second exam will be your midterm. And so next week is midterms week, right? Yeah. So I'm thinking like maybe Tuesday or Thursday of next week, your midterm exam. Probably Thursday. So everybody always wants to push it, right? Oh, later than sooner. We'll see. I would like to give you 2 exams for your midterm grade, right? Wouldn't you want 2? Particularly if you didn't do so hot on the first test. You go, I need something to pull up my grade. Well, I tell you what, of my 4 tests, this one's the easiest. And so, yeah, use this test to bring up your average if you need to. But if you did fine on the first test, then hey, just whatever. But anyway, that's it. Well, there's the final, which counts twice. So it's like you have 5 grades, right, if you want to think of it like that. But yeah, you just have 4 tests. Yeah. First, second, third, and fourth. Your 4th test is your final, and it counts twice. That's the same one. The 4th test is your cumulative grade test. Yeah. And I say it counts twice because it's like there's 100 questions instead of 50. The first 50 questions is like a normal test. It'd be just over the last quarter of the course. And then the last 50, questions 51 through 100 are repeated questions from the first 3 exams. That's what makes it comprehensive. That's how I do it. So you guys good? My Zoom people, any questions out there in Zoom land? Y'all been behaving so nicely. I haven't heard anybody turn their mic on or anything. Okay, well, I'm going to go, and I will see you guys Thursday. All right, adios.